What if the food you're eating right now is quietly setting the stage for a disease that, in 10 years, could take your eyesight, damage your kidneys, or even cost you a limb? I'm talking about type 2 diabetes, and this isn't something that only happens to older people or people who are overweight. It's increasingly happening to young, active people who think they're eating pretty well. Today we're breaking it all down, from the ground up. When you eat, your body converts carbohydrates into glucose, which enters your bloodstream. Your pancreas responds by releasing insulin, which works like a key. It unlocks your cells, so glucose can get in and be used as energy. In type 2 diabetes, your cells stop responding well to that key. This is called insulin resistance. Your pancreas produces more and more insulin to compensate, until eventually it burns out. The result, glucose builds up in your blood, progressively and silently damaging blood vessels and nerves. This is different from type 1, which is autoimmune. The body's immune system destroys the pancreas's insulin-producing cells from the start. Type 2 develops gradually, over years. The main risk factors include a sedentary lifestyle, a diet high in refined sugar and ultra-processed food, excess weight, especially abdominal fat, family history, and age. But the factor growing fastest today is modern lifestyle itself: poor sleep, chronic stress, and fast food as a dietary baseline. Warning signs you shouldn't ignore: excessive thirst, frequent urination, constant fatigue, blurry vision, slow healing wounds. If you notice several of these, talk to your doctor. A simple blood test can tell you everything. Here's the part I love most about this topic. Type 2 diabetes is, in many cases, preventable and partially reversible. Clinical studies prove it. Physical activity: you don't need a gym. Walking 150 minutes a week, about 20 minutes a day, reduces the risk of developing diabetes by 58%, according to the NIH Diabetes Prevention Program. That's more effective than many medications. Real food: more vegetables, legumes, lean protein, and healthy fats. Less added sugar, refined flour, and sugary drinks. This isn't about a perfect diet. It's about a sustainable pattern. Losing 5% to 10% of body weight, if you're carrying excess weight, can fully normalize glucose levels in people with prediabetes. Type 2 diabetes isn't inevitable. For most people, it's not a genetic sentence. It's largely the result of an environment that pushes us toward habits our bodies were never designed to handle. The good news is that small changes, sustained over time, make a massive difference. You don't have to do it all at once. Just start. If this video was helpful, save it to watch again. And if you know someone who needs to hear this, share it. Sometimes that one link you send can change someone's life. See you in the next video. Take care of yourself.